Hi, my name is Kayla, RN on duty on day shift for the adult psychiatric unit, and I am ready to give report. Our current situation is Justin is in the main day room. He is coloring an adult coloring book with colored pencils. He has requested these items, stated that the coloring does keep his hands busy and his mind quiet. He has been doing so peacefully without incident for the past couple of hours. He is not speaking to anybody unless spoken to. That does include patients and staff. The background for this patient, Justin Hawkins, is a 30-year-old Caucasian male. He was brought to the emergency department by the police. He was at the gym that he attends and had a verbal and physical altercation with a member. He did push her and she fell over the treadmill. He was very agitated upon arrival, pacing back and forth, was talking very loud and very fast. He was difficult to understand. He stated that he was diagnosed with schizophrenia at the age of 18. He also stated that he has been off his medication for approximately 2 weeks. The police officer did ask him to sit down as he was becoming very agitated, and this only agitated him further. He then pushed and kicked the police officer, and while he was waiting for the hospital security to arrive, a triage nurse tried to intervene, and he also pushed her. She did fall, hitting her head as well. When enough people were present, he was able to be restrained to have Haldol and Ativan administered via IM. He did calm down once the medication did take effect, so the ER nurse could do her initial assessment. After that assessment, Justin's father did arrive and apologize for his behavior to the medical staff. He also had a conversation with his son and told Justin that he's just exhausted and tired and he just can't handle all these outbursts any longer and he's just done. So told Justin that he was no longer allowed to live with him, which is where he was residing prior to. And as you can imagine, he was very upset, but his father did go ahead and leave the emergency department at that time. When a bed was available, Justin was admitted to our unit up here in adult psychiatric. He had his normal medications that he previously was not taking restarted, his risperidone and the citalopram. He did take those without incident. He also does have the Haldol and Ativan for PRNs for agitation. He is employed as an electrical journeyman. He's an apprentice. His mother died approximately 15 years ago. He did have a recent breakup with his girlfriend because he stated she was trying to poison him. For the assessment, all the vital signs were stable and within normal limits. He is on room air, denies pain, no drains, tubes, or IVs. Really to note for the assessment for mental health, he's alert and oriented ×4. He has just a linear thought process at this time. He does repeatedly state that Big Pharma and his father are trying to control him with medication. He understands why he was admitted for his schizophrenic behaviors, and he does deny any suicidal thoughts or audio or visual hallucinations, and also denies thoughts of self-harm. For his mood and affect, he's very flat and watchful. He doesn't speak unless spoken to. He does agitate easily. Right now his speech is calm. He is not interacting with anybody, but once he does become agitated, his voice volume does increase. So you will note that he is becoming more agitated by the volume of his voice. The main problem today was a psychotic episode in the emergency department. The patient was then calmed after the effect of the medication had taken place. Another incident on unit was when Justin was in his room. He was pacing back and forth, had clenched fists, and was making a punching motion I had entered the room and stood by the window. He was unaware that I was there. I was just observing his behavior, was going to further assess the patient at this time, and he did not notice me in the room. So when he did become aware that I was present, he came at me with clenched fists. So my recommendation would just be to 100% of the time make sure Justin is aware of your presence, or anybody going into that room. Be sure that he is aware. Be sure that he's in the right state of mind. If he is upset, we can always come back at a later time to address anything that needs addressed. Has stated that the coloring book and color pencils are a way for him to keep calm. It keeps his mind quiet, and it has been very effective these last couple of hours. So that is a nice escape for him. Just be calm with him, and just, again, let him know that you are present, and as to not agitate him or cause any behaviors in that regard. That is all I have for you. Thank you.